So now we're going to assess the abdomen. So for the order of assessment for the abdomen, it's actually going to be a little bit different than every other system. So we're going to start with inspection, then we're going to auscultate, then we're going to percuss, and then we'll do palpation. Okay, so the reason we do this is we don't want to disrupt any bowel sounds or the peristalsis in the abdomen. So we'll listen first, start from least invasive, and move into most invasive. So for inspection, I'm actually going to come eye level to the abdomen and look at the shape and contour of the abdomen. Okay, I'm looking for any dips, I'm looking for distension, obesity. Okay, so if she's maybe malnourished, it might look like scaphoid, which means there'd be a little concave to it. Okay, if she's pregnant or obese, it's going to be more rounded. Okay, but she has a nice flat belly, so we can move on with the next thing. So for for auscultation now, I'm going to listen to 5 areas. Okay, so there's our 4 quadrants for the stomach, but the 5th area I'm going to listen to is actually over the abdominal aorta. So just like any other vessel, I'm going to listen to it with the bell of my stethoscope. It's going to be over the umbilicus, right under the sternal area. And again, I'm listening for bruits, which is that turbulent blood flow. And I don't hear any bruits, and it sounds fine. Okay. I'm going to switch back to my diaphragm and start listening for bowel sounds. So again, you're going to break down your abdomen into 4 quadrants. Okay, so use the umbilicus as the midline there, and you have your right lower quadrant, right upper quadrant, left upper quadrant, and then your left lower quadrant. Okay, so try to visualize the organs that would be in those quadrants. So for your right lower quadrant, you might have your appendix. Your right upper quadrant, you're going to see your liver. Okay? Left upper quadrant, you have your stomach, you have your spleen, and then in your right lower quadrant, your left lower quadrant, you're going to have your colon. Okay? So always start with the right lower quadrant over the ileocecal valve. Okay, this is where your bowel sounds are going to be heard loudest. So you're going to press hard enough to leave an indentation, and you're going to listen until you hear for bowel sounds. If I didn't hear any bowel sounds, or they were maybe a little bit slower, I'm going to listen into each quadrant for 5 whole minutes. Okay? So that's only if I don't hear anything or if they're very hypoactive. So again, listening over the ileocecal valve. She has very active bowel sounds, so I'm going to move up clockwise until I hear them, and then move. And finally on the left lower. Very good. So now if we've auscultated for bowel sounds, we can start percussing. So the sound for percussion over the abdomen is going to be a tympany. So it's going to be a hollow sound, almost like you're hearing it over like a watermelon. Okay. So this is just air over the abdomen. Okay. And again, you're going to start and work your way clockwise. Alright. If you are going to look for the areas like the liver, you can percuss to find out how big your liver size is. So you would start from the lung and do resonance down until you hit dull. Okay, so if a dull sound is heard, that means you're over a master organ. So you have resonance over the lung field, come down to you hear dull, that's the top of the liver. Then you're going to come up from the base of the abdomen and hear tympany, and then change to dull. So that's going to be the base of the liver. So the liver in an adult should be somewhere between 6 and 12 centimeters. Okay, so it's going to be roughly in this area. Okay. So now moving on to palpation, I'm actually going to start with one hand to do a light palpation first. So again, starting in the right lower quadrant, I'm just lightly palpating, seeing if I feel any type of mass, or if my patient is rigid in any way, or if she's guarding, or if she's feeling any tenderness. No tenderness? Perfect. So then I'm going to switch to a bimanual technique and get a nice deep palpation, really seeing if I can feel the different organs or any masses. And I'm not feeling anything abnormal, so I can move on to special testing. Okay. So when you're palpating, you're going to look at different organs now. So to palpate the kidneys, I'm actually going to use what's called the duckbill method. So I'm going to come on one side, and make a duckbill, trying to feel around the back to feel the kidney. Now on the opposite side, it's going to look almost like an upside down duckbill to palpate that second kidney. You can also palpate areas for the spleen, and you shouldn't feel anything for the spleen. If you feel something on the spleen, that means the spleen is enlarged 3 times its normal size, meaning it could rupture. So if you do feel anything that you would think is a spleen, take your hands off right away, because that would be an emergence, and we do not want to rupture that spleen. Okay. The next special test we could do is called the hooking method. So this again is going to feel for the liver base. So you're going to find the bottom of the thorax, you're going to take your hand like this, and they're going to deep breathe in, and you're going to hook right under that thorax and let it out. And you should feel the base of the liver right along your fingertips. Okay? This is a way to feel if the liver is enlarged or also if it has nodules on it. Okay? So again, you're hooking under the rib cage, and then they're letting that out, and it's going to right against your fingers. Okay? The next thing we can do is called the Murphy sign. So this tests for anything wrong with the gallbladder. So what you're going to do is you're going to have your patient take a deep breath in, and you're going to push right over the left upper quadrant, the right upper quadrant. Okay? She wouldn't be able to take that full inhalation if she had anything wrong with the gallbladder. So again, for the Murphy's test, go ahead and let it out. You're pushing on that right upper quadrant while they're taking that deep breath in, and they wouldn't be able to get that full inspiration if they had anything wrong with the gallbladder, because that pushing would cause a lot of pain. Another test we can do is looking for the appendix. And if the appendix is on my right lower quadrant, I'm going to try the rebound test. So instead of palpating on the appendix itself, I'm actually just going to push down on the left lower quadrant and bring it up really quickly and see if any pain is rebounding to that side. So if she had appendicitis, if I push on the opposite side, it's going to radiate pain all the way to the side of the appendix. Another test we can do for the appendix is the iliopsoas test. So I'm going to take her right leg, pull it up, and then push down on the thigh. So this would cause increasing pain along the appendix. Okay? And another special test we can do could be for ascites. So if you suspect your patient has ascites or free fluid in the abdominal area, you can do the fluid wave test. So I'm going to put my hand here to kind of separate the sides of the stomach, and I'm going to smack on the sides. And if she had ascites, you would actually see fluid making waves along the abdomen. She does not have ascites, so you wouldn't see that, but that is the method we would use. And those are my special tests. And that's all I have for the abdomen.